So, good morning. Today we'll start with the prescription chapter. Now, again, we are going to discuss what is meant by prescription basically, what are the different types of drugs basically, what is the main classification of drug, then what are the different parts of prescription, means in the parts of prescription, what are the directions which are given by the physician to the pharmacist as well as to the patient. So the definition of prescription is, it is an order written by a registered medical practitioner directing the pharmacist to compound and dispense the pharmaceutical product to the patient. So basically what is mean by prescription? So it is an order written by a registered medical practitioner. You all know that when we went to the physician or when we went to the medical practitioner, whatever the disease or whatever the disorder we have, he used to write the medications on that particular paper, that we can call it as it is an order. That paper is having the name of the prescriber, that is name of your doctor, his address, his registered number. The very important things are there which are mentioned on the prescription or that order. And that prescription is basically, it is the direction for the pharmacist to compound and dispense the pharmaceutical product to the patient. Means that prescription contains the direction to the pharmacist how to compound that particular medicine, how to formulate that particular medicine, and after compounding, how to dispense that medication or how to dispense that pharmaceutical product to the patient. Okay, then prescription contains the direction to the pharmacist as to what type of preparation is to be prepared. As I told you, prescription contains direction to the patient also, as well as it has the direction to the pharmacist also. So it has the direction to the pharmacist regarding what type of preparation it is to be prepared. Okay, whether that preparation, what is the type of that preparation, whether it is solid, liquid, any thing, whatever is to be prepared by the pharmacist. So what type of that preparation is to be, then how much it is to be prepared. So what is the quantity of that preparation which is to be prepared by the pharmacist. So these are the direction to the pharmacist, whereas there are some direction to the patient also. So what are those direction? Now how much medication is to be taken? If you have seen on the prescription, doctor have prescribed, say for example, paracetamol, so 1 that means one tablet in the morning, one in the afternoon, one in the evening. So how much quantity of that medication is to be taken, which is very important direction in patient point of view. Then how many times it is to be taken. So whether it is to be taken 2 times a day, 3 times a day, 1 times a day, that is another direction to the patient. Then how it is to be taken. So that medication is to be taken by which route of administration basically. Okay, so how it is to be taken, sometime what is the route of administration, then how it is to be taken in the sense whether that medication is to be taken before meal, whether it is to be taken after meal, like that. Okay, so it is an important legal document required at all stages of dispensing of prescribed medicine, and is complete only when it is signed by a registered medical practitioner. So it is very, very important that whatever the prescription is, that we know that it is a legal document or it is a written order, and which is important at all stages of dispensing of that prescribed medicines. Okay, means say for example, if the patient went to the, what we can say, pharmacist with that prescription. Okay, so it is being important or it is being required at all stages of dispensing that medication to the patient, and it is complete only when that prescription is signed by the registered medical practitioner, or that registered medical practitioner is nothing but your physician. So therefore, we can say that prescription provide the information to the patient also, as well as to the physician also. So we have considered that it is the point of interest, or we can say it is the communication link between the physician, pharmacist and patient. Okay, because that prescription, it is concerning to the physician also, it is related to the pharmacist also, as well as it is related to the patient also. So therefore we can say that it provides a contact, or it provides a communication link between all these three peoples. A pharmacy should inform the prescriber about the drug sensitivities a patient may have. Okay, so this point is again very important. Now, whatever the medications a that a prescriber is going to prescribe, so before prescribing those medicine, it is the duty of prescriber also, means it is the duty of that physician also to ask about the medical history of that patient, whether that patient is having sensitivity, whether that patient is having some resistance to the particular medication or not. So along with the physician or prescriber, pharmacy should also inform that the patient is having some sensitivities, the patient is having some reactions with that particular drug. So few of the examples are, say, for example, if aspirin, as you all know that it is an analgesic, NSAID, plus alcohol. So if the aspirin and alcohol, these two medications, or we can say these two agents will combine together, then there will be the enhanced risk of GI irritation with internal bleeding. So aspirin, it is a very common analgesic, or very common what we can say medicine for relieving the pain. So if the patient is alcoholic patient, okay, if that patient is using alcohol, so in those alcoholic patient, if they are taking the aspirin, so there is enhanced risk of GI irritation with bleeding in those patients. So again, it is the duty of pharmacist, or it is the duty of that prescriber not to prescribe the aspirin in alcoholic patient because of this GI irritation. Then the another example, many a time the tetracyclines are being prescribed by the physician. Now tetracyclines are, you all know that these are the antibiotics. Okay, these are used to treat several types of infection. So when these tetracyclines are to be taken along with antacid, now the regular antacid what we are taking is, suppose milk. Milk is an antacid, it contains calcium. So what happens when the tetracycline will combine with the antacid? Their administration together results in the decrease in absorption of those tetracycline. Why? Because the tetracycline reacts with calcium. Okay, antacid means your milk, say for example, it contains the calcium, so the tetracycline reacts with that calcium and it will form the complex that are poorly absorbed. So if the absorption is not there, what will happen? There is no metabolism, there is no excretion. Means whatever the drug or whatever the medicine is there, if there is no absorption, that medicine is going to accumulate in the body and it results in toxicity. So it is very, very important part of the prescription, or we can say it is very important thing in the prescription, that whatever the medicines which are being prescribed by the physician, so it is the duty of that physician also, as well as it is the duty of that pharmacist also to check whether the patient is having some sensitivity to that particular medication or not. Now the drugs are broadly classified, or they broadly belongs to two different types. So the first type of drug is OTC drug, which are called as over the counter drugs. And the second are prescription drug. Okay, so what are over the counter drug? These are non-prescription drugs. Okay, many a times if we have some small headache, if we have some small body ache, so what we people will do, we directly went to the medical shop, we directly went to the chemist or druggist or pharmacist, and we ask him about the medication. So those are considered as non-prescription drugs, because in that case we don't have prescription. Directly we went to the pharmacist without the prescription, or we went directly to the pharmacist before going to the physician. So such a kind of medicines which are to be taken from the pharmacist without prescription are considered as non-prescription drug. Many examples of non-prescription drug, or they are called as OTC drugs, are analgesics like the paracetamol, aspirin, antipyretic, again paracetamol, and antacids like calcium containing product. Say for example Gelusil. Okay, many of the people, they are using Gelusil. So these medications does not require the prescription. Therefore, they are called as non-prescription or OTC drug. Then second type of drugs are prescription drug. Now, prescription drug means Schedule H drugs are of this type. So you might have heard that we have different types of schedule, from Schedule A to Schedule Z. So under each schedule, there are some, what we can say, the guidelines related to particular product, or guidelines related to particular practice. So Schedule H drug means these are considered as the prescription drugs. On the label of such a drugs, it is written in red, warning Schedule H drug. Okay, now Schedule H drug means what? These are the drugs which are to be sold on the prescription of registered medical practitioner only. Means these medication we cannot take, or these medications we cannot even buy from the pharmacist without the signature of physician or signature of registered medical practitioner. Understood? So these are OTC drugs and prescription drugs. Now the moving further, what are basically the parts of prescription? Now up till now we had said that prescription, it is an link between the pharmacist, physician and patient. It is an order written by the physician or prescriber, and it is having the instructions for both the pharmacist as well as for the patient. Now what are the different parts of prescription? What information is to be mentioned on the prescription? So these are so many parts of prescription, like it contains patient information, it have a superscription, it have inscription, subscription, signature, that is also called as signa, refill instruction, and date and prescriber signature. Okay, so these are the different parts of prescription. We'll discuss the parts in detail. Now the first part is patient information. So the information means, of course, it should have name of that patient, it should have address as well as age of the patient, so as to avoid wrong delivery of medication to any other patient. Because nowadays, you know that many a time whatever the medications are there, those medications are to be delivered directly to the address of the patient. Okay, so whatever the address which is given by the patient, it should be correct. Okay, so that there will be the avoidance of wrong delivery of medication. Then age and weight of the patient is also very, very important, because we know that, say for example, if some child is there as well as some adult patient is there, so whatever the dose of your drug is there, that dose of drug, especially in case of the pediatric patient like the child, as well as in case of geriatric patient like the adult patient, isn't it? Because they have, what we can say, altered metabolism, or their metabolism is not proper. So the dose of whatever the prescribed medication is there, it is very important, and that dose varies according to the age and weight of the patient. Understood? So suppose if 500 mg tablet of paracetamol is there, and if the weight of the patient is suppose 70 kg, so 500 mg is required for that 70 kg patient. But if the age of the patient is suppose 10 years, isn't it? So dose of that paracetamol, it may not be 500 mg for that 10 years old patient, or for that 5-year-old child. Okay, it may be less than 500 mg. So therefore, on the prescription, whatever the age of the patient is there and weight of the patient is there, it should be properly mentioned. Then the second part of prescription is superscription. If you have seen any prescription given by the doctor, so on the left hand side corner, the doctor have mentioned symbol RX. Okay, so that symbol, which is the abbreviation of Latin word receipt, meaning take though, it is represented by symbol RX, means receipt, isn't it? Now means what? What we can say, it is the abbreviation of Latin word receipt. So Rx means the recipe of whatever the medications are there, or whatever the medications which are prescribed on your prescription. Now, why they earlier, what used to happen is that nowadays the medicines are directly available, or we can say the medicines are directly manufactured in companies, and those manufacturers, they provide the medication to the distributor, and the pharmacist or those medical shops, they will take those medicines from the distributor. Means nowadays it is not required for the pharmacist to compound the medication. But earlier, what was the situation? The situation is that the pharmacist used to formulate the medicine, and then he or she is responsible for dispensing those medicines or medications to the patient, isn't it? So therefore, there is a part of prescription nothing but receipt, or it is called as superscription. Means recipe is to be there of that particular medication or formulation. Now after superscription, the next part is inscription. Now superscription means recipe. So now what is meant by inscription? So inscription is the main part of your prescription, or we can say it is the body of prescription which contains the name of medicine, which medicine is to be preferred, or which medicine is to be written by that prescriber. Then strength of the medicine. So what is the strength of your medicine? Say for example 500 mg strength, means we can say the amount. Okay, so what is the strength of your medicine? 500 mg tablet, 750 mg tablet, and total quantity. Now total quantity means 10 medicines, 20 medicines, whatever may be the total quantity required for that particular disease. Understood? So inscription is nothing but it is the main part or body of the prescription. Mainly it contains the name along with the quantity of your medication. Then quantity is expressed in metric system. All the quantities should be written one below the other. Okay, metric system means suppose 10, then paracetamol tablet 20. Understood? So it should be written one below the other. The prescription may contain drug and non-drug components such as excipients, because just now I have told you that earlier what was your prescription? The prescription was like there is say for example name of the patient, and there will be the name of the medication in inscription part, and below that, or sorry, in subscription part, and below that what will happen? The names of the drug along with the excipient is given, because the pharmacist used to formulate that medication, used to formulate that preparation, and then it is to be dispensed to the patient. Okay, so therefore earlier the prescription is divided into two parts. That is, it contains the drug component as well as non-drug component. Okay, now drug component means suppose that pharmacist is supposed to prepare paracetamol tablet. So paracetamol, and on the or in the non-drug component such as excipients, the excipients are being listed. Say for example, for preparation of tablet, binder is required, antiadherent, glidant, lubricant, so many excipients. So that inscription part or body part is divided into drug component and non-drug component along with their quantities. Today, majority of prescription include brand name of drug rather than generic names, and pharmacies has to only dispense them. So many a time we also know that instead of paracetamol, many a time Dolo tablet is given. Okay, so that is the brand name. Okay, it contains the paracetamol. Many a times the brand names are given. So it is the duty of that pharmacist to check those brand name, to check the contents, and then dispense those medication to the patient. Okay, then the next part of prescription is subscription. So subscription includes the directions to the pharmacist by the physician regarding the dosage form to be prepared and the number of doses to be compounded and dispensed. So just now in inscription we had discussed the formula of that particular preparation is given. Okay, what is your drug, what are the excipients which are mentioned in the inscription part. Now after inscription, in subscription, the direction to the pharmacist by physician is given regarding the dosage form to be prepared. Means whatever the number of drugs along with the excipients are mentioned in that inscription part. So which type of dosage form it is to be prepared, and how many dosage forms are to be prepared, that is number of doses to be compounded and dispensed. That is basically nothing but subscription. Okay, now after subscription, the next is signatura. It is also nothing but signa. That is the abbreviated form of signatura, SIG or SIGNA. In this form, it is to be written on the prescription, meaning let it be labeled. Okay, now in subscription part, what is there in subscription part? The direction to the pharmacist is given how to compound the medication, and how much amount of medication is to be formulated. Now, once the medication is being prepared, or once your dosage form is to be prepared, it is very essential step to label that dosage form. Otherwise, one should not understand what ingredients are there, how it is to be administered, okay, what are the direction. So whatever the medication, whatever the final dosage form is there, it should be labeled. So that labeling in the indications, or we can say that labeling directions, are to be given in the signatura part. Okay, so it includes direction to be given to the patient regarding dose of drug. So what is should be the dose of drug? Okay, suppose 10, what we can say, 100 ml cough syrup bottle is there. So out of that 100 ml, every time how much dose is to be administered by that patient. So dose of drug is mentioned, route of administration, by which route that medication is to be administered, what is the frequency of administration, means how many times, whether it is to be taken by 2 times, 3 times, what is the frequency, and time of administration, means whether it is to be taken in the morning, before meal, or after meal. So all these things are to be mentioned in the signatura part. Okay, now if the prescriber writes the word label, prescriber means your physician. Okay, so if he writes the word label in the signa, it is the instruction to the pharmacist to mention the name and strength of prescribed drug on the label. Now, we all know that suppose on the lab scale also, or in the laboratory also, when you are performing your formulations or your practicals, okay, at that time also you have labeled that preparation. So in that label, what is very important thing, that you have to mention the name, whatever the name of that formulation or name of the drug, along with the strength of the drug on the label. Okay, means like suppose paracetamol, if we take an example of paracetamol, it is available in 500 mg, 650 mg, 750 mg also. Okay, so what is the strength of your prescribed drug? It should be mentioned on the label. Then the next part is refill instruction. Understood. Now, what is mean by refill instruction? So again, it is very important. It means getting the prescription redispensed more than once by the pharmacist as specified by the physician. Understood means redispensing of your prescription. That is called as refill instruction. The physician may advise a refill when he judges that the patient requires another course of same treatment after a particular interval. Isn't it? Means what is basically the refill instruction? So refill instruction means, we can say, redispensing of your prescription. Okay, means say for example, if the patient is suffering from say fever. Okay, now suppose for 5 days a doctor has given him some medications. Okay, doctor has prescribed him some medication, but after 5 days also, if the physician ask the pharmacist, or if that physician directs the pharmacist to redispense that prescription once time more. Okay, means again, if the physician wants that patient to repeat that dose again for next 5 days, then that is called as refilling of the prescription. Isn't it? Means with the same prescription that that patient is going to the pharmacist. Okay, because physician has given those directions to the pharmacist to redispense the prescription. Okay, means again to repeat those medication for next 5 days, the same prescription. Understood? So that is called as refill instruction. Now the direction may be given as repeat teacher. Repeat teacher means suppose 1, 2, 3, 4, 5, it is like this. So repeat up to a designated number, isn't it? Now suppose here these two is under the these two is under, suppose we can say, suppose under the circle. That means what? You have to repeat these medications 2 times. Okay, twice in this case. Means suppose first 5 days you have already taken those same medication, then again next 5 days, again next 5 days, means 2 times you have to repeat the same course. Okay, so that is nothing but repeat teacher. Then the another direction, suppose the physician have given the direction as PRN. Okay, now PRN means pro-renata. So repeat when occasion arise. Understood? Means in this case, if the PRN is mentioned on the prescription, so that is means it is not repeat teacher. Okay, you have to repeat this medication only when you are suffering from fever. Okay, means only when the occasion arises. Then the third direction is NR, that is non-repeat teacher. Non-repeat teacher means do not refill. Okay, there is no need to refill the medication, or there is no need to repeat the medication. Understood? So refill instruction means if that prescription is to be redispensed. Okay, if the whatever the dose which is prescribed by the physician, if that patient needs to repeat the same dose, but the under the supervision of that physician only, or as directed by the physician only. Understood? Then that is called as refill instruction. So these refill instructions are in the different, what we can say, direction, like repeat teacher, it may be pro-renata, it may be non-repeat teacher. Okay, now prescription with refill instruction should be given back to the patient, of course, because that the patient is going to use those medication again for next 5 days, for example. Okay, so he should have that prescription with him. So prescription with refill instruction should be given back to the patient. Then the last part of the prescription is signature, address, and mobile number of that prescriber. Okay, so very, very important information of that physician or the prescriber is his signature, what is the address, what is the mobile number of that physician. So all other parts of prescription may be printed or typewritten, but the prescriber name must be handwritten and should be signed in ink. Understood? So maybe whatever the prescription we have, so all other parts of the prescription, whatever we have discussed, they may be typewritten or they may be printed, but the name of the prescriber should be handwritten and it should be signed by the ink, or signed in the form of ink only. Now, prescription containing narcotics, or we can say narcotic drug or other habit-forming drugs must bear the address and registration number of the prescriber. Okay, you all know that this narcotic drug or other habit-forming drug, we can say sedative drug, hypnotic drug. Okay, all these drugs, they require the supervision, or these drugs, what we can say, these are Schedule H drug. Okay, these are the prescription drug, isn't it? So in the case of these drug, or for dispensing this drug, the signature of your prescriber or your physician is very, very important. So if the prescriber is going to prescribe such a kind of medication, so that prescription have the address of your physician along with his registration number. The physician's address and phone number help a pharmacist to call back in any case if the clarification is required. Isn't it? Now, if the address of your physician is mentioned on the prescription, if the phone number also being mentioned on the prescription, so it is very, very helpful for the pharmacist to call back to that physician in case of any clarification. Okay, because many a time, say for example, a simple thing is that many a time the handwriting of that physician is not readable. Sometimes the spellings of most of the medicine, we can say these are similar, like in case of SALA medicine, okay, Sala medicines, or we can say the sound like look-alike medicines, okay. So their spellings are same, their sounds are same, their pronunciation is same. So many a time there might be the, what we can say, small mistake while writing, while prescribing those medication, okay. So in that case, it is very important to have the address of physician as well as phone number of the physician or prescriber on that prescription, so that that physician or that pharmacist can be easily contacted by the pharmacist. Okay, so these all are the parts of prescription, like patient information, superscription, which is nothing but receipt, then inscription, that is the main body of the prescription. It contains the drug component as well as non-drug component. Then subscription. Now once your formulation is being prepared, okay, now what is meant by subscription? So that is contain the directions given by the physician to the pharmacist, how to be prepared by how to prepare the medication and how much is to be prepared, okay. Now once your preparation is being prepared, then it is required to be labeled. So those labeling directions are given in the signature, okay. Now if some patient or if some physician want to redispense the prescription, okay, if that physician wants to repeat the dose to that particular patient, so it is to be given in the refill instruction, okay. And the last part is very important, that is signature, address and mobile number of that prescriber, which is very important to contact that physician in case of emergency or if any clarification is required by the pharmacist. Okay, thank you.